Hi, my name is Camry Agee, and I will be discussing my interview with the therapist. The therapist that I chose to speak with is Jasmine Parker. Her credentials are MS ALC under the supervision of Jonathan Williams. I started the interview off by asking the name of the practice and how long it had been in existence. The name of the practice is All Care Community Wellness, Education, Counseling, and Consulting, LLC, and it has been operational for the past month. However, it was functional prior to recent rebrand for 2 years under another company. The change was initiated to be exclusive and provide services that were appealing to all based on affordability. I then asked her about the client population, what type of clients that she usually sees. She stated that in her practice, she sees adolescents along with adults. Most clients that she sees have adjustment disorders, depression, anxiety, bipolar disorder, and in some cases, suicidal ideations. I then asked about the therapy modalities that she utilizes, and she stated that she uses CBT, motivational interviewing, acceptance and commitment therapy known as ACT, attachment-based therapy, narrative therapy, reality therapy, strength-based therapy, and solution-focused therapy. I then asked Jasmine to describe a time where she had to console a patient and how did she handle that situation. She stated that whereas she's typically works with clients who are depressed or in crisis, she do recall a male client that was going through a divorce and attempting to navigate a custody battle with minimal support. He was feeling very defeated and stated that he felt helpless along with just being very tearful. She asked him about how was it for him navigating having that minimum support as a male, and he stated that he was in unfamiliar territory in addition to him even being able to communicate his struggles openly to anyone. During that session, she stated that they practiced wording and how to discuss needing support and how it will alleviate some of the stress and emotions that he was feeling at the time. I then went on to ask Jasmine her opinion on what is the most important quality in a therapist. She stated that the most important skill a therapist or a social worker can have is active listening, empathy, and problem solving, or paying attention to details. I then asked Jasmine if she ever recalled facing a situation where she was unable to properly diagnose a client or offer helpful counseling, and if so, how did she address it? She stated that she doesn't think that there was a time where she was unable to properly diagnose a client due to her background in assessments along with gathering full intakes to have insights on the clients beforehand. However, she says that if the situation ever arises, she would usually refer out or consult with a clinical supervisor or therapist that may specialize more in the area of the client's symptoms. I then asked her what factors does she assess before recommending a treatment plan. She stated that she would assess before treating a client, and that would include biological, psychological, and social data. The individual's physical health, mental health history, current symptoms, cognitive function, and support systems, as well as their strengths, challenges, and specific goals for therapeutic services are also very important. I then asked Jasmine if she could highlight her educational and training background that prepared her for this role. She stated that she has completed her master's in science in counseling from Faulkner University, Additionally, she has completed a postmaster certification in counseling and trauma from Grand Canyon University. She added that she's also a triage therapist that assists those in crisis, along with being a 988 call taker, which allows her to use her skills, including active listening, and still being effective in the many type of modalities, as all the callers aren't the same and may potentially be variable in diagnosis. I proceeded to ask Jasmine how she would approach a situation where a client is hesitant to speak during sessions. She stated that handling guarded clients has been a strong suit of hers, as she makes the intake process welcoming and having open communication regarding the process and how therapy should be, along with gathering their assumptions and anxieties surrounding therapy. She also reassures them that therapy isn't restrictive and it's their time to have full disclosure, as they are benefiting from speaking to a therapist. I wanted to close out the interview by asking Jasmine her advice on what she would say to new social workers or therapists entering the clinical practice. She stated that she would just tell them that they should be ambitious about learning new skills and getting involved in the mental health and social work community, along with keeping mentors and support systems that will help them grow as a clinician around them at all times. I thank Jasmine for taking the time out to speak with me and also just giving some insight into what she does, and maybe having the opportunity to motivate anyone who has the opportunity to listen and see what their business is all about, and hopefully that continues to thrive in this community. Thank you.